Hi everybody. Thank you all so much for coming here. Thank you so much to Invest Ottawa for hosting the space, and thank you AI Thinkers for organizing everybody here. I'm really excited to see you all here. You don't even know how exciting tonight is. I know for you it may be a regular Tuesday evening, but there are so many ideas brewing in your head right now, and you're probably already thinking of really cool ideas and projects to work on. So I'm really excited to tell you more about healthcare subject. If you don't know where to apply your skills, you can apply them here. My name is Valentyna. I'm a user experience designer at Lumka Health. Lumka is a virtual healthcare software that's providing a way to connect patients to providers or providers to providers. Working in healthcare, I've noticed there are a lot of opportunities for improvement. Our healthcare is under a lot of stress right now, and we really need to do something about it to make sure that everybody's healthy and happy, and all the healthcare workers have a good work-life balance and also enjoy their work. This picture, by the way, was generated by AI. This is what AI thinks the future of healthcare is going to look like. So in this talk, I'd like to talk about the state of healthcare, what approaches to transformation are out there, different areas of opportunity, and some examples of AI applications, what challenges are there with AI, and how you can get involved. Healthcare today is focused on sickness care. You've probably, gotten sick once or twice and you would go to your doctor, but you would wait forever maybe to go see your doctor. And then when you go to your doctor is like, there's Tylenol for that, you should just take that and that will cure all your problems. But it won't, because most of the time your symptoms are going to get missed and you won't get the proper care that you need, and it will take you about 3 to 5 years to get diagnosed with anything. Treatments are limited and outdated. There are a lot of them, but they're not being implemented right away, so you won't get the perfect treatment. It won't be personalized for you, it will be just one of those general Tylenol prescriptions. Your data is siloed as well, so all of their information will be at one clinic, but your other clinic won't get access to it either if you're moving provinces. You basically have to go and get them to print out a stack of papers for you so you can move that over to another province. And that leads you to fragmented patient care. You don't really know what's going on with you, and none of your healthcare providers actually knows what's going on with you either. In other news, healthcare professionals are burning out, which have been used for a while. Even before COVID, they were already burning out, but COVID made it worse, and now people are just out. So they're leaving practice, retiring, or changing careers in general. Funding is distributed. Most of it is focused on acute care, like ERs. This is where most people go to get treated. So this is not very sustainable because other areas get missed. Our technology is also outdated. People are still relying on fax. This is an article from February this year. Calgary Clinic lost 5 months worth of referrals. A friend of mine actually waited a year, 2 missed referrals to get his surgery for ACL, which kind of sucks. Change, as you can see, is being resisted. Fast change is all out there, and this is a big problem. To implement all the new technology, which brings us to regulations, they have to pass lots of regulations before new things can be put in place. For Canadians, it's pretty decent. 60% of people rate their health as very good or excellent, which is nice. However, only half of people meet physical activity and nutrition guidelines. 85% have healthcare provider, but that leaves 4.5 billion people without a family doctor. Our Asian population is growing, so by 2050, every 4th person is going to be able to make use of their senior discount. In terms of disorders, this is, in terms of mental health, anxiety and disorders are rising, unfortunately, and there's other health conditions that are on the rise as well. And not everybody gets access to healthcare. Some of the communities, like people without homes, LGBTQ, minority population, and indigenous people don't get enough access to healthcare. So how can you fix it all? Well, you can do two major things: is help the patient or help the healthcare professional. In helping the patient, you want to make sure that the person stays healthy first, not wait until the person gets sick. And it would be really cool to have community care-based wellness where you have a team of professionals that are there for you and monitor your health and prevent you from getting sick. For helping healthcare professionals, it's all about reducing their workload and making sure that there are enough health professionals out there, so like training and education. And that all can be done by creating partnerships that are focused on a specific problem. So some of the areas of opportunity are personalized medicine and treatment, clinical decision support for healthcare providers. Part of this is medical imaging. This is a really cool subject. Remote monitoring and telehealth, that helps a lot with aging population, monitoring people from long-term care homes. Operation administration really helps with speeding up physician workflows. A cool and exciting topic, robotics. There's a lot going on there as well. And all of this can be done with more research and analyzing everything in that space. For personalized medicine, you can create personalized treatments. You can have all the data taken from your body, wearing all the wearables and everything, analyze all that data, analyze your genomic data as well, which can help with predicting all the different diseases and figure out if you're going to have a certain disease, which also can help you with your engagement in your own health. And you'll learn more about your own body more. One of these examples is NeuroMind. I don't know if you've heard about this. This is a project at Algonquin College. They're making this app for people with concussions, which looks really cool. You wear this headband, and it gives you real-time brain energy monitoring. It has different training modules that improves your cognitive performance as well. And you can set your own limits. So if you have a concussion and your brain is tired, the app will actually tell you, like, hey, you should take a break. And then you can go and do some guided meditations from this app. One cool fact about this is that it looks pretty cool. It has a dark theme, but it didn't start with a dark theme. It was really bright and white, which is not, it worked, but for patients with concussions, it did not work because it was too bright and we couldn't handle all that brightness. So it really worked for them to do user testing in this case to make it actually usable for people and help them. In clinical decision support, you can use AI to analyze patient data to predict patient outcomes, create personalized treatment plans, mitigate risks of different diseases, and reduce medical errors in general, which also speeds up your diagnosis. So you don't have to wait 3 to 5 years to get diagnosed. You can just use this cool app. It's called Articulate Medical Intelligence Explorer by Google Health. It is a large language model optimized for diagnostic reasoning. So essentially, as a patient, you can just talk to this, and it will tell you what your diagnosis is. It has a better performance than clinician-assisted by AI, which is super cool. But one thing to note, this is a research project, so don't use this for your own diagnosis at this point. Not yet, at least. Just wait a little bit. Medical imaging is a really cool space. There are a lot of images being generated, but not enough people to actually analyze all those images. So AI can take all those X-rays, MRI scans, CT scans, and automate all that image interpretation process. It will help with early detection of abnormalities, it will screen for diseases, and it will help with early intervention and better prognosis. This AI app can analyze those scans, give real-time insights, create automated assessments, accelerate diagnosis, and alerts the team if they find anything suspicious in there. This was inspired by an actual case. There was a neurosurgeon that did brain surgery on a patient That surgery was successful, but there was not enough time to actually help the patient, so the patient died. And this neurosurgeon was like, well, guys, we can do better. Like, let's do something about it. So he found a machine learning person and created this app just like that. He had an idea, he walked up to an expert. Now there is this app that helps a lot of people get diagnosed. For remote monitoring telehealth, it looks like, imagine you have a grandmother and she really needs extra care. And she's in a long-term care home and you want to make sure that she has all the necessary help that there is. So you might give her some devices that she can wear to track all her vital signs, track her environmental factors, track everything that she's doing, because she's probably not going to tell you all the details so that you don't get worried. So there's continuous monitoring for everything like this, and if she has some chronic disease, you can also help her with managing those symptoms and living with that. And if she needs a follow-up, she can just do that from the comfort of her home, and she doesn't have to go to the hospital. And most likely, she'll be more engaged and getting better. She'll learn more about her situation, she'll feel more empowered. This particular application is for monitoring patients at the hospital after a surgery. So your friend did something funny, did his own stunt, got hurt, got cut up, and stitched up by the doctors. And then you look up to him at the hospital, and he has this thing hanging on the side of his bed with fluid draining from the wound through his bed, through this device. This device has pH and electrical conductivity sensors that analyzes that liquid that goes through this device. And then all this data is analyzed in real time and shown on this monitor. So if something goes wrong, something's off, the surgeons can cut your friend up again, clean it up, stitch it back together. Right now it takes about 8 days for the body to actually show that something's wrong. So if you have something that detects it early, you can not wait 8 days until something goes bad. In operations administrations, AI can help with many things. These are only 5, but there's a ton of stuff that it can speed up. For example, resource allocation, scheduling, workflows, revenue cycle management, monitoring quality assurance and compliance, making sure that the clinic is up to date on all the different best practices, and of course documentation. Doctors are notorious for not actually keeping up their notes, or sometimes when you go to visit a doctor, he's not talking to you, he's looking at the monitor, typing up all those notes, and you don't even know if he's hearing you or not. This particular application is helping with that exactly, so your doctor can actually focus on you instead of typing notes. So this is a conversation ongoing between provider and the patient, and then at the end of the conversation, it generates you a templated note that the doctor then will read just to make sure it's okay, and then save it. This app also uses, has medical dictation for other kinds of notes, so that the doctor can just say something and it will generate all those notes for the person. It also has really cool voice commands and integrates into different EMR. So this screen in the back is in one of the EMRs that doctors use on a regular basis. This is like an overlay of Dali. And you can use voice commands in those integrated EMRs to save some time. And it has a cool feature of medical search. It's like Google, but for medical professionals, where your data is actually curated and you can trust this data instead of Googling things and going to Mayo Clinic that will tell you you have cancer. This one is a little bit more trust. In robotics, there are a lot of applications. You've probably heard about robots doing surgery. It looks kind of scary, but it will do surgery better than surgeons. I mean, surgeon is still there. It's not like AI-powered robots are actually doing work for you. It will be more precise. You won't have big scars, hopefully, and and it will mitigate risks of infection and other things. Robotics is used in rehabilitation as well. It will guide you through different physio exercises. For patients that can't walk, for example, they can wear an exoskeleton, and then it will help them get around, which is really important because, if you can't really walk, you still want to enjoy some of the things that this exoskeleton would allow you to. There are robots that are being used at hospitals right now that walk around and help people. And there are even robotic animals. They will provide you emotional support and will provide cognitive stimulation for people with dementia or Alzheimer's. One of these robots is Moxie. It's a socially intelligent robot who can perform tasks around the hospital, like moving things around, or checking on the patient, delivering medicine to them as well. It has an arm, so you can do mobile manipulation for different things, like moving things around. It learns from other people, so the more staff using the robot, the better the robot does. And it has these really cool expressions. You definitely know it's not going to stab you in the back all day. In research, there are a lot of applications as well. 30% of all data in the world is from healthcare, and that data is growing at a rate of 36% annually, which is a lot. There's no human hours to go through the data, so you have to have some good machine learning models to help with analyzing those vast amounts of data. It also helps with treatment discovery and development, especially for clinical trial optimization, which takes years, so it's important to make sure that you have selected proper treatments for the trial. And it also automates a lot of biomedical research as well, so pipetting and cell culturing and things like that. Now this is one of the most exciting things out there. Protein folding has been a problem for a long time and people didn't really know how it works. So proteins are little building blocks of life. Everything is based on these proteins. Every function in your body is happening because there are so many of these molecules that are interacting with each other. And if you know how this is done, if you know how this protein is being created, if you know this process, you pretty much solve everything. So this AlphaFold project is done by DeepMind from Google, and they have made the massive of this for free for everybody. So anybody can use all the information from this to apply their research. It's already being done. 190 different countries are using this information to drive further the research. So with this, you can understand lots of different diseases. There is no time for addressing neglected diseases. That's a separate thing. It's called neglected diseases. I can't remember the name, but it's kind of funny when they're called neglected. But this creates this opportunity to address them now, so that the research is done faster and people are getting the proper treatment now. So, what are some challenges with AI? Well, your AI can be biased, and it will tell you that Chihuahua is actually a delicious blueberry muffin. So you have to make sure you train it right. There are other ethical considerations for that reason as well. Make sure that you have people from different backgrounds that is part of the learning model. And lots of people still don't trust AI, which is fair. You may not want to do that right now. And then, if your AI does give you a good diagnosis, who's responsible for it? Is it the doctor that uses the AI that's responsible for it, or the AI itself that's responsible? People are still on the fence about this, so lots of conversations to be had around this. And then who owns the data, what's happening to the data, all the patient data and everything. Has to be properly collected, stored, and disposed of as well. And of course, regulations and compliance. Governments are talking about this right now, and they should start talking about this faster because there are so many tools out there, and people already started using them in the space. So this is a problem as well. So, with all that said, where do you even start? Anybody's really overwhelmed yet? With all the different problems? You don't have to solve them all, though I do expect that by the next time I'm here, you've solved healthcare for everybody. So you can start with small things, like joining existing projects, like Valentyna, for example, has this cool project and goals. You can join it and learn a little bit more, analyzing ways to control Alzheimer's disease. You can join a startup, a startup could probably help you with that. Or you can tinker with your own project idea. Let's say you go tomorrow and you go hack event. You can come over, think of any one of your ideas from here, or talk to your friends, ask them what they're struggling with, talk to your doctor friends, talk to anybody who's in the healthcare space, they will tell you a lot about it. And once you have an idea, you can apply for grants, get some funding, tell people, just ask them, give me some money, and go from there. Thank you so much. Any questions?
If you're interested in getting involved or working on one of the opportunity areas you mentioned, can you talk about sort of course there's a lot of regulatory challenges, right? You mentioned like someone's using a fax machine, the jump from fax machine to AI has missed a lot of steps. Can you talk about like which of those areas potentially have fewer regulatory hurdles or tech companies trying to build in those spaces?
Oh, good question. It's regulations are everywhere. I don't know if you can ever avoid them. Healthcare is a very regulated space, and you essentially cannot avoid them with precedent, unless space, probably personal health, I think. That would be the one where you can create an app dedicated to some problem for people, losing weight or mental health or something like that, or creating meditation apps or something specific like this, targeted for people rather than for healthcare professionals. That space is a little bit more dense than patients.
Hello. I'm Ottawa, actually. I work for doing, right now I actually do like LLM stuff for a healthcare startup. But one thing that you can do is, this question I guess, is, so yeah, the data regulations are pretty bad. One thing that hospitals or like healthcare places want is for there to be no sort of data leakage if you ever want to use some sort of platform for LLMs. So like you probably the play if you have some complicated prompt engineering setup is to like plug and play Llama 3 or sort of like open LLM to do some sort of like thing, right? So like for example, you could summarize medical notes or aggregate them in a certain way, not saying that this is the product to work on, but there's all sorts of things you can do there. The question I had was just, does the company that you're at right now have an AI sort of initiative that they're working on?
Thank you for your question. We're definitely looking into it. We don't have our own AI, but we're around so many different AI solutions, and a lot of healthcare professionals that we're talking with, they really stress the importance of using AI in healthcare, especially with the notes. That's the number one thing. Give us something that will help us not to take those notes. We really don't want to spend extra time in there. We have patients to take care of, and so yeah, looking into different options.
So you listed a bunch of companies there. Are all of them available in Canada, or is each company like focusing on a specific country or region?
Right, so most of them are in Canada. The Fluid AI one with the surgery one is in Kitchener, actually. It's a startup. They have done Series A funding end of last year. That was local, the Uruguay is local, out of Algonquin, and I think there was one from the States, but everything else is Canadian. Oh, I guess the Google Health project is in the States. But, thank you.
Hi.
There was, oh, yeah, hi.
If you are currently tinkering or have a healthcare product, AI product that you're working on or in some stage of development, do you have any suggestions, avenues for things like RFPs or grants, like where to go for that kind of thing?
Where to go for that? West Ottawa, they have a lot of resources who want to do that. Check every startup in Canada that can help you with that space, for sure. You don't have to be in like Regina, Saskatchewan, for example, to be a part of the startup there. They will give you more information on where to get funding.
Sorry, what was that last suggestion you had?
Oh, join startups, startup incubators, I mean,
Oh, okay, I understand.
is what I want to make, yeah. Okay, I think I'm getting a very lot of questions. Is there maybe one last question? Okay, yes.
Another one to watch out for is Darwin AI out of Waterloo with Dr. Alex Yuan. But I think one of the things you have a lot of challenge with AI for apps for healthcare, especially for electronic medical records is that the hospital themselves are on different EMRs. And so like the hospital can talk to each other. And if they move provinces, they don't talk, the system doesn't talk to each other. So we have some fundamental data quality, data standards issue that really, I hope some kind of federal initiative will try to find bridges where the data can be transferred from one province to another or one EMR to another, because this is just absolutely nuts right now.
I agree, it is nuts. Within the same city, hospitals, doctor clinics, nobody really knows what's going on with you, it's insane. So
It's
to,
a different system than the Ottawa hospital, which is an Epic. So
Yes.
yeah, so it's like, you gotta be kidding, I gotta, and then the private clinics will be different system, but yet all together. So that my medical record from years ago when I was living in East End is not matched up with my medical records from the Ottawa hospital and not from the x-rays from and the blood tests from private clinics.
this is a big problem, not just in Canada, really across the world. Everybody has a different system to use. And Canada Health Info is actually working on this right now. They have a lot of different conferences around making everything interoperable, so you can, if you use one thing and then use another, you can transfer all that information together. So there are some things happening in that space, thankfully, but that takes some time. So hopefully we get there soon. Thank you everybody for your time.